Hi, this is another episode of our short-term, high-impact discussions. And here we are with Eleni Hadjigeorgiou, who is going to start a very interesting discussion. Eleni, can you start sharing who are you?
Thank you for this opportunity. My name is Eleni Hadjigeorgiou, a difficult name. I am from Cyprus, a small island in the Mediterranean region, and I am an assistant professor in midwifery in Cyprus University of Technology. I represent my country and the Midwives Committee in International Confederation of Midwives, in European Midwives Association, and we try midwives in Cyprus to do many things.
Like what?
To be honest, as the first midwife in Cyprus with PhD, I try to, with all midwives in Cyprus, to improve midwifery care, but first and above all, to improve midwifery education. For me, knowledge is very important. I believe and always teach that knowledge is power. Therefore, I try with my colleagues to improve this knowledge. And thankfully, now we have in Cyprus 5 midwives that follow their PhD. And I am sure that the future will be very, very fruitful.
It is true that, Eleni, you are the one who started the midwifery Master of Science degrees and PhDs, and you supported your country really in a really wonderful way. So thank you on behalf of everybody else for the work you have been doing.
And allow me to say that the previous cost and this cost for me was very important, because I found in every member of this cost something to bring back to my country. And it is very important that Europe has all these programs, especially for the small countries. The big countries, they don't have problem because they have a lot of people to support each other. In the small countries, we need this support, and I'm thankful to the people that create these programs.
Now, going back to our theme, which is your research within post-action devotion program, what exactly is the title or the theme of your research?
I am in the working group 2, and our main research was about maternity healthcare providers' experiences of traumatic birth. It is a very important research, and I am sure that when we finish it and when we publish it, we shall give to this important subject new details and new data, how to deal with all these problems that healthcare providers face during birth, and not only during birth and during perinatal period.
So this is a little bit different from the usual research theme, which is looking at the traumatic experience from the part of the person who gives birth to a baby, mother or father. So what was the reason why you started this specific research. What did you see? What were the challenges?
The biggest challenge now in many countries in Europe, and not only Europe, I think all over the world, is the medicalization of birth. We have an increase in cesarean section. We have many women that complains that they survive, as they said, during their birth. All these affect healthcare providers. And something that, okay, we are not sure about the results, but something that I found in a previous research is that the obstetricians now, they don't have the opportunity to do normal births. So they forget, they prefer to do cesarean in order to avoid any mistake during normal birth. And the women, they hear all the time that with the cesarean, I can, let's say, schedule what to do and things like that. And the women, unfortunately, they don't get the right information. And we have this now, this phenomenon. Many women ask for an cesarean, and they said that is their preference. But actually, it's not their preference. It's something that comes from the environment. They create this preference. And the healthcare professionals and midwives and student midwives, they are there. They saw what is happening. And many times they wish to do something, but they cannot. Why they cannot? Unfortunately, in some countries, midwives are not autonomous and they work with obstetricians. And the obstetricians are the managers of the clinics. So the midwives, even if they wish to explain to the women what is happening, they try, but by the end, they don't want to lose their job. So let's say they keep quiet, but all this causes them stress. And already with one of my students, we investigate midwives' experiences during traumatic birth, and we already published some results of this, and I can talk about that. I'm not going to say anything about the survey that is taking care, that is took part in many countries, is in progress, because we must publish those results and then to announce anything. But the one that already done with my student, it is obvious that in Cyprus, midwives suffer. And another thing that is very important is the national health system. The national health system now in Cyprus give a lot of authorities to the obstetricians, and that affect again midwives' role, because now many obstetricians create their own maternity clinics. The public maternity clinics, unfortunately, they don't have women that wish to attend in the public hospitals. So all the women move to the private sector, and in the private sector, the midwives are there, but they are not independent. They are employees of the obstetrician. And that creates another problem, and is something that I wish, and with the Ministry of Health and the Midwives Committee, try to find the best solution how to deal with this situation.
What have been the steps so far? I mean, was that the situation like this all the time, or is it a recent phenomenon? And why did midwives or health professionals lost this skill or art of normal or natural birth?
The problem begins some years ago when the obstetricians increase in numbers. In Cyprus, we have 300 obstetricians and we have 300 midwives. So the obstetrician should earn money. How they are going to earn money? They collect everything to them in order to have job. So they said that they will take care about the normal births, but at the same time, they are obstetricians and gynecologists. So they schedule their surgeries. If you schedule something, you must schedule also the births. So they explained to the women that, listen, it's better if we start your labor instead of waiting. And the women said, okay, doctor, you know better. So, okay, go ahead and start my labor. And by the end, the cervix does not dilate it because it's not ready. And they went to the cesarean. This is not my belief. It's something that we can find in the books. And not only that, in the perinatal data that is published, we saw that Cyprus is the first country in cesarean section rate for how many years? For 8 years now. In Europe, we are the first country. Why this is happening? The women are the same, but things are changed. And now the health system, the Minister of Health, invite us, I mean the universities, the midwives committee, the obstetricians association, and we had a very useful meeting, how to decrease and how to deal with this medicalization. And of course, they invite people from the World Health Organization. And I'm glad to say that the scientists from the World Health Organization said to them, listen, if you wish to decrease the number of cesarean and decrease the number of normal births, there is only one way, increase the number of midwives. It's the only way, and give them more authorities. And our law is very, very well constructed. I mean, nursing and midwifery law. We don't have problem with the law. We have problem with what is happening around us, with the national health system. They didn't, let's say, did a good plan how to deal with the perinatal care. I am sure that now the women react and the Birth Forward, which is a non-governmental organization and represent women, they try with many women to react to all of this. And midwives, again, midwifery committee, react to all this. I think by the end, we can do something to solve all these problems.
We hope so, and we wish that, Eleni, to all of you and the society in Cyprus. But coming back to the theme, speaking about the challenges and the issues that health professionals, and you mean midwives or perhaps nurses or perhaps other professionals, health professionals, you explain later. What are these traumatic experiences that they bring to discussion or to the surface. Could you say a few things about that?
Yes. The biggest problem that the healthcare professionals describe is the hemorrhage. And they found hemorrhage, and it is hemorrhage during birth is a big issue because it's not under your control. You must act immediately and efficiently. This is one thing. The second thing is the death of a baby. Unfortunately, in Cyprus, we don't have maternal mortality, but we do have some IUD, intrauterine deaths, and things like that. And midwives or obstetricians that experience a death that affect their life. That's why devotion, it was a very useful, and I said it is a very useful, very useful for the countries, because they gave us the opportunity to be together and to learn what is happening in other countries. And in other countries, the healthcare professionals have support, and very wisely in Israel, for example, they said to us that every week they create a team and they discuss all together what is happening. This is very important, the communication. In Cyprus, we do have problem with communication. Unfortunately, we do have this problem. And we must do, let's say, something to improve the communication between midwives, obstetricians, pediatricians, to work better as a team.
Debriefing or supporting
Yes.
the mental health of all those present at something traumatic.
Yes, and not only that, I think that in many countries they create programs, special programs, how to support healthcare professionals when experience this trauma. Because healthcare professionals need help in order to be more efficient on their work, because otherwise they will be affected. And sometimes we're talking about empathy. Empathy is very important, because if you treat someone with empathy, and if a woman has a positive birth experience, that will affect their life forever. And you know better because you are a psychologist.
Yeah. The thing is that what do these midwives, these health professionals bring to the surface? Is it fear? Is it powerlessness? Is it guilt? What are the feelings that they bring? All of them.
All of them. And I'm sure that in the survey, we shall have the opportunity to see what is happening in the countries that participate, because the 12 countries are participating in this survey. And to be honest, for me, I wish to see this survey to continue, because we stop it now because the devotion is at the end. But I wish to find a way to continue this survey, to see what is happening around the world, not only Europe, and to collect more data and to see, for example, in the North countries, midwives are very powerful. The problem is the North side. In the North side, in many countries, midwives have more problems. So we must bring them the optimal care that is offered in the North countries in the South countries to the North countries. It is very important to see, to help each other, to support each other.
Learn from the best.
Yes, learn from the best and improve, to bring improvement.
Mm-hmm. So what remains to be done? And that's why you quiz, and perhaps you will do steps towards the continuation of this survey. What remains to be investigated, or which is not included now, or there is very little evidence so far because that was not included in the design of the survey at the beginning. So what is it that remains to be done?
To be honest, I don't want to, let's say, to say in advance what will happen after the survey. But we know that we collect only 500, around 600 questionnaires from all over the Europe. And we are millions. So we must collect more data in order to find to find what is happening around us, because some countries, they contribute to this survey with less than 100 questionnaires, and they have thousands of women's mothers, healthcare professionals, and things like that. So I think we must find a way to continue this survey in the future. I don't know what will happen with the devotion. I have no information about any future collaboration, but I will try to, let's say, to find a way to continue our cooperation.
Right. Is there anything else, Eleni, that you would like to add from your experience working on this influence or impact on the health professionals, especially midwives, being witnessing a traumatic birth? Is there anything you would like to communicate?
Yes, I wish to say that I know that there are special programs that they can be offered to the healthcare professionals, and they can help them to reduce their anxiety. Because if you are anxious during birth, this anxiety, it's obvious in your face, in your actions, so that affect the care that we offer to the women. So we must find a way to help all these people. And another thing that is important is the obstetrician in Cyprus. When I know I talk about my country because I know for sure, because I'm here. Many times said to me, do you know what is happening if something bad happened during birth? Do you know what is happening with the law? So they said to me, we try to protect ourselves. That's why many times we, let's say, try to avoid normal births because we don't know for sure what will happen. But we must say that cesarean is not so safe as they present it. And the women, they must know that cesarean section has many disadvantages, but we don't explain to them those disadvantages. And many women said, oh, cesarean is better for my baby, it's better for me. It's not better for them. If they have to do it, of course, cesarean is a life-saving. Cesarean saves lives, but not to do cesarean for no reason. Normal birth is better for the women and for the babies. That's why we try to explain to the women that they must have a normal birth for their benefits, for their family's benefits, for their baby's benefits. It's not only because we wish to promote normal birth. We know what is best for them. That's why we try to help them.
Right, right. Is it the same? Just my curiosity, Eleni. Do you include obstetricians in the survey as well?
Yes,
And
yes.
have you noticed that the obstetricians also are affected by this traumatic experience during birth? Yes.
We shall see. We shall see, because, as I said, I cannot say anything about the results because that we didn't publish yet the survey. But this is a very important result. From the others studies that we include in our scoping review, yes, we found that, yes, of course, the obstetricians are affected too about the medicalization of birth. So the obstetrician need help also, and the pediatrician need help also. Therefore, the healthcare system, they must find a way to help all healthcare professionals.
So actually, just to summarize it, we need to look at it and explore the situation and map the situation, and we need more data for that so that we can have a very...
We agree. You are right. Yes, we need to find a way to offer to the women, to their babies, to their families, to the society, better care. All healthcare professionals should find the way to have a good cooperation, a good communication to offer to their women, to their what we call them now, to the women, babies, families, as I said before, the best, because we can do it.
And you need to introduce and adopt practices and support systems that work in a good way in other countries which have already used that. And we need to look at the legal aspects as well, so that we see the best balance point where the professionals, health professionals, will not be paralyzed by the legal impact, or if they allow themselves to do more the way nature has it,
Yes.
and less the technology can have it. So there is a lot of good work to be done in this direction. Is there anything you would like to ask your colleagues in Europe or elsewhere?
Yes, I wish to express my gratitude to all the members of the course that I participate, this course and the previous course. And I wish to see all these people in the future. Thank you for this opportunity. Thank you, everyone.
Thank you, Eleni. That's another short-term, high-impact discussion with Eleni Hadjigeorgiou.